Carrom business perspective, I don't think this will have a strong impact on us. It will certainly remain to be seen. I wouldn't be surprised if there are individuals that, maybe they've part-time jobs and they have Medicaid coverage today, but that also, there might, there is a possibility, that maybe employers will say, I'll have to step into this because, if they're not having any healthcare, I might move into this. So there's certainly a possibility that on the margins, this could lead to potentially an increase in individuals who have employer-sponsored insurance, right? Which means they would then have, if they work with those employers that are our customers, they would then have access to the network that we build, the high-quality providers, and all of this, which is certainly a change we would be appreciative of. But it's really hard to say, right? It really depends on exactly how it's structured. And no, I think from a commercial perspective, you certainly want to see, make sure you have enough spare capacity in the network for this, right? But, just looking at the numbers, right? There's 160 million individuals who have insurance through their employer or their spouse's employer or their parents' employer. And so, I think even if there's pretty material changes in Medicaid eligibility, that's probably only a fraction of that 160 million would be my guess. And so, yeah, there's some capacity things you have to think about, but I don't see that as a concern, and I don't see people thinking about that as a problem per se. I don't think anybody has a real solution to this. Right? Obviously there's a lot of talk is always made about, well, let's look at other developed countries and see how they organize their healthcare system. And there's challenges everywhere, right? I don't think there has really been, I don't think anybody's really stumbled upon a solution to this. I think the one thing that we have, as a company that we have seen work, is harnessing really the power of the markets, right? Harnessing, for example, competition, right? The power of competition can do a lot. You have competition among car manufacturers, right? So they've really optimized how we make cars, right? So the price of cars, right, is actually, I mean, with the invention of the assembly line very early on, right, that came down. And so, we believe that if there is more competition between providers, that can lead to more efficiencies because they'll focus on them, they'll find them. And what I don't know is how on a policy level to translate that. Carrom Healthy can do this, right? We go into a market, right? We look at who are the providers, we find a provider that is cost effective and very high quality, and then that's who we work with, right? And they get then rewarded with more business. And if that provider isn't cost effective anymore, then we'll go out and take another look at the market. And right, that is a very powerful lever. I think that is, if there was a way at the sort of federal policy level to bring this idea of competition more into the mix, I think this can be very powerful. I don't know how this can be done, right? I'm not a policy specialist. I don't know, what the appetite is, what the feasibility is, but this whole idea that, you use competition to drive efficiencies, to being the motivating force for efficiencies, is a very powerful one. And I don't think we've seen enough of that, certainly on the health policy side.